Great to have you here. We start with some disturbing news. More than 10 preterm babies have died this year at the Kpandai Polyclinic due to lack of incubators. For the babies to survive, they have to make an over 200-kilometer journey on a very terrible road to Salaga before connecting to the Tamale Teaching Hospital. Medical Superintendent of the Polyclinic, Dr. Raymond Abongo, believes more babies can be saved if the hospital gets at least one incubator. Solomon Jojo Kobna has details in the following report.
Delivering a preterm baby can be very stressful, but in the Kpandai district of the northern region, it is twice or even thrice more stressful because the hospital has no incubator. For babies to survive, parents would have to practice the kangaroo method. In very severe cases, they would have to be referred to the Tamale Teaching Hospital, which is over 200 kilometers away. Health workers say the Ghana Ambulance Service requests 500 cedis for fuel to make that journey. Unfortunately, many who cannot afford the fee fail to travel, and so their babies die.
And we try to manage in our own small way. But sometimes these children develop these complications and it's beyond us because we do not have the neonatal intensive care unit and we have to refer them. A lot of them would have to go by public transport to Tamale to access the neonatal intensive care units there. So we have had close to 10 or more babies die because they were unable to access neonatal intensive care unit services. That is what we have done all these years.
Esther Mbalewo, a resident of Kpandai, says it is very dangerous carrying tiny babies on terrible roads to Tamale.
It helps traveling with a preterm baby from here to Tamale. It's a very long journey, and the babies too are very tiny. Traveling with them is very difficult. So if you can help them, help the hospital get an incubator, so that anytime we get those kind of babies, we can attend to them here instead of referring them to very far distance.
The polyclinic has no official vehicle, so they have to rely on commercial vehicles to travel for medical supplies.
And I usually would have to rent a pickup. If there's sufficient time for me, I rent a pickup. But sometimes the duty call is quite impromptu, and then it's difficult for me. Sometimes I have to go by the Metro bus or some of the other public transport.
Dr. Raymond Abongo says he would have loved to use his personal vehicle for official duties, but because of the poor nature of the road, he cannot even drive into the district. For now, he rides a bicycle to work every day. To check on patients who cannot travel to the hospital, still, his best bet is a bicycle. Health workers in Kpandai say, although they have many challenges, they urgently need at least one incubator and a vehicle to ensure babies born in the area are at least given a chance to live. Jojo Kobna, JoyNews.
The producer of that story, Jojo Kobna, is here to help us understand this rather unfortunate situation better. Thank you so much, Jojo. That's not the first time you've gone to Kpandai. The first time we were there was an incredible story we told of a woman who, but for our crew, may have lost her baby. But this is a different angle to the story. Can you paint a picture of how this works and even how the children get to the Tamale Teaching Hospital? You've used that road.
I have used the road, and you know, in my mind, I'm just thinking how a baby can survive that journey, because even as an adult, it was stressful. In a very good vehicle, a Prado, a very huge vehicle, had the shocks, and then you can navigate very rough terrains. I still wondered how. I'm still wondering because I don't know. The Kpandai road is extremely terrible from Salaga, getting from Kpandai to Salaga before you get to Tamale. Crossing over to Salaga alone is a nightmare. It's worse than a nightmare. in the rainy season, it is difficult. I mean, you see many vehicles breaking down along the road and people walking, and then they beg you for lift. That is what happens. And then dry season, the dust. So I'm just wondering how a baby can make it.
And not talk of just a baby, but a preterm baby. And we know how vulnerable they are.
A preterm baby making it. Now, the doctor told me a story of they got a good vehicle, normal vehicle, and then tried to take a baby to Tamale. And in the car, in that particular vehicle, they connected the oxygen to the baby so that the baby can make it. And because of the terrible terrain, the cylinder, the oxygen cylinder, hit the nurse, and she blacked out. Oh, so they had to manage 2 cases. Now they had to pray so that they can survive. Luckily, they survived, but the nurse was totally knocked off because of using that particular stretch. So you can imagine, and many people cannot afford. The National Ambulance Service there would charge you 500 cedis from Kpandai to Tamale.
Can you help us understand the kind of people who live in this community? When you say they cannot afford, what do you really mean?
Well, they're largely farmers, peasant farmers, and the already terrible nature of the road makes it very difficult for them to transport your goods. So, I mean, they are poor in the very first place. And then they having the burden of coughing up 500 Ghana cedis immediately so they can take their babies to Tamale is also a big difficulty. And so the best bet would be practicing the kangaroo. But there are situations that you cannot practice the kangaroo when the situation is even, is the baby's condition is worse off.
And the kangaroo is where the mother keeps the baby.
Or can even be the father on the skin. It's the skin to skin contact. And then I understand that it helps the baby to go. Now, the reason why this project is very personal to the medical superintendent at the Kpandai Polyclinic is because he had 2 preterm babies. But luckily for him, the babies were born
outside that
jurisdiction. And so they survived. So he was saying, I mean, I was just wondering if my wife ever delivered here, whether my babies would be alive. And so it is something that is personal to him, and he says that just 1 incubator can do a big trick, can change the lives of many children in Kpandai.
What is the cost of this just 1 incubator you refer to?
Well, I started Googling the cost of an incubator. It's just around $2,500. That is like 12,000 cedis. So looking at our current exchange rate, 12,000 cedis. And 12,000, to think that 12,000 cedis can give life to so many babies. I'm wondering why we cannot pull resources together and make sure that the Kpandai Polyclinic
gets
at least 1 incubator.
And how many communities does this polyclinic serve?
Jesus. Okay, the entire Kpandai district has just 2 health centers, because Kpandai Polyclinic is not really a hospital, it's a polyclinic. Then we have Evangelical Church of Ghana Hospital, only 2, 7, so many people, so many communities scattered all over. And so it is a real burden on, there's a huge burden already on the facilities. And many children come there. And mind you, there are so many people who even deliver at home. I mean, they never make it to the hospital. They always deliver. You can imagine, the very day that I was doing the story, the doctor was on the phone trying to get one of the smaller community nurses to deliver a baby.
And they had to do this over the phone
because getting there I mean, by the time if the doctor would have to use the road, get into that community, the woman would have died. So he was saying, please handle the situation, make sure that something happened, and the baby was delivered. So we have many people delivering outside the hospital.
So clearly there is a need for this incubator. But what is the district assembly saying about this project for the polyclinic?
Well, it has to do with funds. It has to do with getting the right funding. You remember in the same story, the doctor said they had no vehicle. what the disassembly is doing about it is that they occasionally give them their vehicle to Tamale, but they have to fuel. Sometimes they give them fuel to travel to Tamale. But I mean, that happens when the disassembly is not, the district health directorate is not really using the vehicle. And so they need, and they have petitioned, they have written letters, they have been talking about getting an incubator, but there is an issue of funding. 12,000 cedis, 12,500 cedis can give them one incubator, and it can save so many. I mean, to think that we are equating a life to 12,500 cedis, I mean, I think it's not fair, and so government needs to step up.
Briefly, Jojo, because you've been to Kpandai quite a number of times and you've brought us stories from there, from someone who is listening, just help us understand why this is important, and if they can, why they should support and how they can.
It's important because Kpandai is so underdeveloped. You know, my trip traveling through the district, it got to a point that I was extremely I was so disappointed. I saw poverty upon poverty, and it became depressing to the point that I even became numb to it. Now, when I saw poverty, and I saw serious situations, I saw terrible schools, health pushed. You know, I stopped feeling that feeling that I used to feel, because I'm like, the problem there is enormous. So we really need. I'm very grateful that someone donated an aesthetic machine to the Evangelical Church of God. I think this time around we also need it's just one incubator. Just one incubator will go a very long way to save. And if anyone is touched by the story and the plight of a doctor who has moved away from his comfort zone and riding a bicycle to his office and back, and also checking on patients, and he is sacrificing, I think that we should also pull our resources together to support him so that he can save more lives.
Thank you very much, Jojo Kpandai, and thank you for going all the way to Kpandai to get us these stories and get the impact that is needed. Now,